7 warning signs of blocked heart arteries in legs and feet. Imagine you are taking a stroll in the park. The sun is shining, birds are chirping, and everything seems perfect. But suddenly you feel a strange sensation in your leg. Is it just fatigue, or could it be something more serious? Today we are going to explain a condition that affects millions of people worldwide, yet often goes unnoticed until it's too late. We are talking about blocked heart arteries in the legs and feet, also known as peripheral artery disease (PAD). This condition can affect anyone regardless of age or background. But there's a good news. If it caught early, many of the serious complications can be prevented. That's why it's crucial to recognize the warning signs. In this video, we will explore 7 key warning signs that could indicate blocked arteries in your legs and feet. By the end, you will be equipped with the knowledge to potentially save your own life or the life of someone you love. So, let's proceed. Understanding peripheral artery disease (PAD). Before we get into the warning signs, let's quickly understand what we are dealing with. Peripheral artery disease or PAD occurs when the arteries that supply blood to your limbs become narrowed or blocked, usually due to a buildup of fatty deposits called plaque. This plaque buildup, known as atherosclerosis, can happen anywhere in your body. When it occurs in the arteries leading to your legs and feet, it can cause various symptoms and potentially serious complications. Several factors can increase your risk of developing PAD. This includes smoking, high blood pressure, high cholesterol, diabetes, obesity, and a sedentary lifestyle. Age also plays a role, with the risk increasing as you get older. In a healthy circulatory system, blood flows freely through the arteries, delivering oxygen and nutrients to the tissues. But in PAD, the narrowed arteries restrict the blood flow, leading to various symptoms, especially in the legs and feet. Now that we understand what PAD is, let's explore the 7 warning signs that could indicate that you have this condition. Remember, early detection is the key, so pay close attention. Warning sign number 1. Leg pain or cramping during activity. The first and perhaps most common warning signs of PAD is a symptom called intermediate claudication. That's a fancy term for leg pain or cramping that occurs during physical activity like walking or climbing stairs. Here's what happens. When you are at rest, even partially blocked arteries can usually deliver enough blood to your legs. But when you start moving and your muscles need more oxygen, these narrowed arteries can't keep up with the demand. The result? Pain, cramping, or a feeling of heaviness in your leg. Typically, this pain subsides after a few minutes of rest. But here's a catch. It usually becomes back once you start moving again. This on-again, off-again pattern is a hallmark of PAD. This pain can occur in various parts of your legs depending on where the blockage is located. It might be in your calves, thighs, or even in your buttocks. Some people describe it as a burning sensation, while others feel more of a tightness or squeezing. If you are feeling this type of pain, don't brush it off as just getting older or getting out of shape. It's important to mention it to your doctor, especially if it's a new symptom or getting worse over time. Warning sign 2. Weak or absent pulses in the legs or feet. Our second warning sign is something that you might not notice on your own, but your doctor can easily check. Weak or absent pulses in your legs or feet. In a healthy circulatory system, you should have strong, easily detectable pulses in several places in your legs and feet. The most common spots doctor checks at the top of the foot and behind the knee. When checking for the pulses, doctors can use their fingers to feel the rhythmic beating of blood through your arteries. These pulses may be weaker than normal in PAD or even completely absent. A weak or absent pulse doesn't automatically mean you have PAD, but it's definitely a red flag that warrants further investigation. Your doctor might use a special device called a Doppler ultrasound to get a more detailed look at your blood flow. Remember, you can't reliably check these pulses on your own. That's why regular checkups with your healthcare provider are so important, especially if you have risk factors of PAD. Warning sign 3. Changes in color or temperature. Our third warning sign involves changes in the color or temperature of your skin. Our third warning sign involves changes in the color or temperature of your skin, particularly in your legs. When your arteries are blocked, less blood reaches your extremities. This can cause noticeable changes in your skin's appearance and feel. You might notice that one leg appears paler than the other when elevated. Or when you are sitting or standing, your legs or feet might take on a bluish or purplish tint. This discoloration happens because your tissues are not getting enough oxygen-rich blood. Along with color changes, you might also notice temperature differences. The leg or foot with reduced blood flow may feel cooler to the touch compared to the other side. These changes can be subtle, so it's important to pay attention to your body. If you notice persistent differences in color or temperature between your leg or feet, it's time to consult your doctor. Warning sign 4. Slow healing sores or wounds. Our fourth warning sign is particularly important to watch for, especially if you have diabetes. Slow healing sores or wounds on your legs or feet. In a person with healthy circulation, small cuts, blisters, or other minor wounds typically heal within a few weeks. But when blood flow is restricted due to PAD, the healing process can be significantly delayed. You might notice that a small cut or scrape just doesn't seem to be getting better even after several weeks. Or perhaps a blister from new shoes is taking much longer to heal than you had expected. This slow healing occurs because your body needs good blood flow to repair damaged tissues. Without adequate blood supply, your body struggles to deliver the oxygen, nutrients, and immune cells necessary for proper healing. It's crucial to inspect your feet and legs regularly, especially if you have diabetes or other risk factors for PAD. Any wounds that don't show signs of healing within a few weeks should be evaluated by a healthcare professional. Warning sign number 5. Shiny, hairless skin on the legs. Our fifth warning sign might surprise you. Shiny, smooth skin on your legs with little to no hair growth. In a healthy circulatory system, your skin receives ample blood supply, which nourishes hair follicles and maintains normal skin texture. But when blood flow is restricted due to PAD, it can affect both hair growth and skin appearance. You might notice that the skin on your legs, especially below the knee, becomes usually smooth and shiny. It might look almost like it's been polished. Along with this change in texture, you may also see a decrease in hair growth on your legs and feet. This change often happens gradually, so you might not notice it right away. It's a good idea to periodically compare both legs. If you notice one leg has significantly less hair or a smoother, shinier appearance than the other, it could be a sign of reduced blood flow. While not everyone with PAD will experience this symptom, it's an important one to be aware of. If you notice these changes, especially in combination with other symptoms we have discussed, it's worth mentioning to your healthcare provider. However, if you are experiencing these sensations along with other signs we have discussed, it's crucial to get checked for PAD. In conclusion, we have explored 7 key warning signs of blocked heart arteries in your legs and feet. Remember, having one of even several of these symptoms doesn't necessarily mean you have PAD. However, they are important warning signs that should promote you to seek medical attention. Early detection of PAD is crucial. If caught early, lifestyle changes and medical treatments can significantly improve your circulation and prevent serious complications like heart attacks, strokes, or even limb amputations. Eating a balanced diet, staying physically active, maintaining a healthy weight, and not smoking are all great ways to keep your arteries healthy. By being aware of these warning signs and taking action if you notice them, you are taking an important step in protecting your health. Remember, your legs carry you through life. It's worth taking care of them. Thanks for watching. If you find this video helpful, please like and subscribe for more health education content. And remember, always consult with a healthcare professional for personalized medical advice.